While you're dealing with patients of psychological ailments, whether it be an anger management patient, a patient of depression, a patient of mania, a patient suffering from bipolar affective disorders, it can be a mood disorder, it can be a simple phobia, a delusion that he's suffering from, and you're going to choose you're going to choose between the different sorts of the treatments that are available to you. You're weighing the risk versus the benefit ratios in that particular case, and that's quite peculiar for that particular case, for that particular person that you're dealing with. We've already discussed the different sorts of the psychotherapies that are available, ranging from the cognitive, ranging from the behavioral, and ranging from the humanistic approaches that are available. Once you're done with the talk therapies and you want to couple these talk therapies with the pharmacotherapies, a range of drugs are available out there, ranging from the tricyclic antidepressants to the serotonin reuptake inhibitors to the MAO inhibitors, to the anti-anxiety drugs or the anxiolytics that is prescribed in a lot of cases of manias or anxiousness in a lot of cases. So when you are done coupling with all of these, you have coupled the pharmacological therapies with the psychological treatments, and the outcomes or the prognosis is not quite good, you're going to try out the other different things. For example, the electroconvulsive therapies. You have the psychosurgeries, that is basically the lobotomy that is quite commonly performed now. And then you have the exposure therapies, you have that flooding phenomena that is sometimes observed. Then you have the cybertherapies, that is known as the online therapies, or the therapist is basically interacting with the patient through the web pages that have been formed, and this is another newer form of the therapies that are being used nowadays. So these are the different treatment lines that can be sought to when you're treating these patients of the psychological ailments in these particular cases. So the other aspects of these psychological treatment cases which we have to discuss, culture is one of the aspects that has to be kept in mind. Then we have the cybertherapies, and then we have the psychopharmacological therapies that have to be devised over here. So when we talk about the electroconvulsive therapies over here, the biomedical treatment in which the electrodes are placed on either one or both sides of a person's head, an electric current strong enough to cause a seizure or a convulsion is passed through the electrodes. So it's one of the treatment that is devised in a lot of cases over here. So when is this sort of a treatment, or when is this sort of a therapy carried out? It's again very important over here. The biomedical treatment in which the electrodes are placed on the either side. So this is the placement of the electrodes. How is this done? We have the bilateral placement. We have the right this is the bilateral basically, and this is the unilateral, the right unilateral placement. It is one of the placements that is sometimes performed. And then we have the electrodes are sometimes put on the bifrontal lobe. So it's one of the ailments or one of the therapies. Now, what are the indications for conducting this kind of an electroconvulsive therapy? It's again very important. You can carry it out for a case of a depression. Usually it is carried out for the cases of severe depression, for the cases of severe bipolar affective disorders, or a person if he's or she's suffering from some sort of a psychotic problems. Even these sort of electroconvulsive therapies can be used. Then another indication is the eating disorders. For example, the anorexia nervosa and the bulimia nervosa. All of these eating disorders can again be treated by these sorts of electroconvulsive therapies that are now quite commonly devised in a lot of individuals. So on the other hand, we have this another kind of a treatment which is known as the psychosurgery. So this is another kind of a treatment which is basically called even the lobotomy, that is carried out in a lot of individuals. Surgery is performed on the brain tissue to relieve or control the severe psychological disorders. Usually this is carried out for psychotic patients suffering from schizophrenia, delusions of paranoia, delusions of grandiosity, hallucinations hallucinations of all kind. It can be visual, auditory, or tactile hallucinations of severe form. And only then we're going to carry out this psychosurgery in this particular kind of a case. Again, it is not the decision of a single doctor. You are going to basically weigh the risk versus the benefit ratio for that particular case that you are treating or dealing with, and only then you can decide whether this particular kind of a psychosurgery has to be performed or not. The prefrontal lobotomy is again carried out, and then we have another form which is known as the exposure therapy that is being carried out in a lot of cases. So we've already gone through the literature of the cognitive behavioral therapies and then the behavioral therapies which were depending upon the classical conditioning phenomena, and then there was another phenomena which is known as the operant conditioning phenomena. We dealt in with two approaches. One was the extinction, in which the stimulus which was causing that particular kind of anxiety in that individual was eliminated from the environment, and even then the anxiety was relieved in those cases. And we had another group of patients in which we performed the flooding phenomena, in which the stimulus which caused the anxiety, for example, it can be a certain kind of an animal in that case, it can be a spider, it can be the phobia of the snakes or a particular kind of an animal. Flooding the images of that particular kind of an animal usually relieved the anxiety in these individuals. Showing a lighter aspect of that animal usually relieved the anxiety in these individuals as well. So this technique was devised by some people in this newer age of the virtual reality, and through the process or through the technology of the virtual reality, different images of the related anxiety stimulus were shown to the patient, and this is how the flooding phenomena was inculcated in these individuals, and a lot of patients were treated through this exposure therapy or through this virtual reality phenomena in these cases. So there are a lot of benefits out of this. What are the indications for carrying out this exposure therapy? It can be given to patients of different anxiety disorders, people suffering from phobias, and it can also be given to the patients who are suffering from PTSD. That is basically an abbreviation for post-traumatic stress disorders in these patients. So it can be like playing a video game. Virtual reality integrates the real-time computer graphics in these individuals. The body tracking devices, they are applied to the body of the individual to monitor the heart rate, the respiratory rate of the individual, just to get the patient out of trouble if he had that anxiety attack or that phobic attack. So the visual displays are shown to the patient, and the sensory input devices are also given to the patient. So in this section, basically, we summarized the different sorts of the therapies that can be devised, ranging from the electroconvulsive therapies, ranging from the exposure therapies. That is, again, another form of the virtual realities, and it basically comprises of the modern techniques of this century that are basically the cybertherapies or the psychosurgeries that can be performed in a lot of cases. So that is the end of this section. Thank you for watching sqadia.com.